Given the context of the events happening last week around the police violence against Black people and the resulting protests, we would expect to see in the near future a rise in number of infections in some areas. Some of us working in the health field are contending that the use of tear gas in a more genetic study, a European study looked at the association of genes with COVID-19 disease severity. They found two genetic loci, including the one that actually determines a very common thing that we know, which is blood type. Blood type A were, for some reason, more likely to have more severe COVID outcomes. On the testing front, Dr. Redfield, the director of the CDC, admitted in Congress this week that data collection has been insufficient to address disparities. And the Department of Health and Human Services has stated that testing data submitted to the CDC will have to have race, ethnicity, age, and zip code information. Those of us working in health disparities have known for several decades that the main underlying causes of health disparities are the social determinants of health. And they include poverty, education, the environment, and healthcare access. Racism is often thought to be one of these determinants as well, because we know that chronic exposure to racism causes the body to change adversely through the release of stress hormones and neurotransmitters. We also know that acute exposure to racism can lead to death, as in the case of the recent killings of George Floyd, Breonna Taylor, Ahmaud Arbery, and others. From a health disparities perspective, the George Floyd shooting was an acute exposure to racism, with 4 police officers serving as the vectors that delivered the disease of racism and its ultimate health outcome, death. But racism also underlies the other social determinants of health, because racial ethnic minorities, particularly Black Americans, also suffer more from income inequalities, educational disparities, and environmental degradation. So from the point of view of the health disparities researcher, there is not much new about COVID-19 pandemic other than the novel coronavirus. The pandemic has had 2 major effects though, besides the obvious health and economic ones. In my view, it's severely stressed all of our dysfunctional systems, the health, economic, legal, and political, to their limits and broke them. We can no longer pretend that they are good enough. They were never good enough except for those of us who enjoy privilege. That is the second major effect. It ripped down the so-called color blinds from our eyes so we can no longer pretend that we all benefit or suffer the same. It has been distressing for us to find out that 1 out of 2,000 Black Americans have died in the COVID pandemic and that their mortality rate is 2 to 3 times more than white people. But again, this is not surprising to disparities researchers. Before all of this, there has been data that show that even Black people in high socioeconomic level have much shorter life expectancy than middle-class whites. The fact is that most of us who are not directly affected hear these reports and then move on. Nonetheless, the data from the pandemic has been revealing and important. And this is one reason why I am constantly putting out the need for more and accurate data. And as has been for decades, the data in this pandemic has been insufficient and often inaccurate. One thing I've learned from 20 years of health disparities research is that whenever the data is not there, it's because somebody powerful doesn't care. And when it is not accurate, it is because somebody powerful wants it that way. One very important example, Congress has for decades prevented federal funding of gun violence and gun control research. So it's no accident that we are always saying we need more and better data for racial and ethnic minorities because there are not enough minorities in powerful places. And in the absence of data, America can pretend that there are not so many health disparities. Just as in the absence of cameras, policemen and law and order people can claim that crimes had been committed and murders were justified. But I'm not a typical academic researcher who only asks for more data. I view those who ask for data on disparities who do not intervene as being complicit in the racist system. We know that even before a single data point was collected, there would be significant health disparities in the pandemic. And we must assume that in the absence of additional data that there are disparities, not that we have to prove they exist. The people who insist on seeing data showing disparities before acting are likely to be the same people who, when such data are collected, will deny their existence or not take them into account in their policies. And so it goes with the economic downturn. We knew before any data came that the small business stimulation package would not go equally to our communities. We know that low-wage workers will be the first to lose their jobs. Many of them are minorities. And I haven't even seen the labor statistics from today, but I can tell you that without seeing it, I can tell you that minorities will have higher unemployment rates. And so it is too with police brutality. At my university, it seems like every single Black man, from the janitor to the tenured professor, has a police encounter story. To me, that's data. There have been enough police shootings of Black men in our time to have the statistic that 1 out of 1,000 Black men can be expected to be shot by the police in their lifetime. We don't need more data. I'll finish by saying, why would a physician and public health researcher concern himself with unemployment and police violence? It is for the same reason that we concern ourselves with climate change, homelessness, food insecurity, educational disparities, income inequalities, and racism. Because the final outcome is a sick or dead person and sick and dying communities. Because racism is a disease and police brutality is a disease vector. And the job of a physician and a public health interventionist are the same. Control the vectors and eradicate the disease.
I started writing about this area, my first book was in 1997. It was entitled Negrophobia and Reasonable Racism, The Hidden Cost of Being Black in America. And it was really about every one of the issues we're talking about today. So it seems nothing's changed but what year it is. It seems that when we were going through these marches in 2013, 14, 15, Black Lives Matter movement, there was a wash, rinse, repeat cycle that you could anticipate that we were always going to go through. It was going to be, first, let's convene a commission. Then let's hold some public hearings. Then let's have some people vent about their frustration and anger. And then we're going to have a few policy folks say, well, I know, here's some interventions that are going to prevent this from happening again. And they're going to come up with some interventions like body cams. Someone's going to say, there's going to be another set of hashtags. That isn't going to have solved it. Someone's going to say, what about implicit bias training? More hashtags. Somebody's going to say, well, what about de-escalation training? More hashtags. And someone's going to say, well, what about community policing? And here we are looking at a moment in Minneapolis, Minnesota, their police department had all those interventions. They were one of the early departments to start implementing all those interventions, and it didn't solve the problem. In fact, as was pointed out going in, you had not only the officer who actually had his knee on the neck of George Floyd, but the 3 others who just stood by. So I think we're coming to the realization that those interventions are, there's not a technological fix. There's not a way to tweak policy and fix this problem, that it really requires some deeper analysis. And that deeper analysis has to do with structural racism, to be sure. The only way we're going to avoid having to go through this discussion again and again is start to address those structural racism issues. But beyond just structural racism, it also has to do with our hearts and minds and our lack of care and concern, empathy for Black lives. Black lives just don't matter is the bottom line here. Black lives haven't mattered since the inception of this nation. A lot of the, as you know, founders were celebrating liberty and democracy and owning slaves. Then we had a cataclysmic race war, 600,000 dead Americans, and we went into Jim Crow. Black lives didn't matter under Jim Crow as much as non-Black lives. And now we're looking at, if you walk down Los Angeles, where I am, you go into Skid Row, you walk down the street in Skid Row, which is probably the fiercest expression of structural violence in America, the largest homelessness encampment in America. Families, everyone, all kinds of folks living there together. 75% of the faces are Black. And I just had to do that number. That's in Down, Out, and Under Arrest, Forrest Stewart's book. 75%, you go into prisons, and jails and the demographics look roughly the same, right? And COVID-19, of course, is disproportionately hitting the Black community. So what's the fix? What's the better solution? I know, you know, as I said, hearts and minds, I think the trope for our problem is Hurricane Katrina and what you saw in the Ninth Ward with those Blacks standing with water up to their necks. And one day goes by, 2 days go by, 3 days go by, 4 days go by. Sean Penn is rowing out up there, handing out fresh water because FEMA still couldn't get its act together. There was not a panic of empathy collectively for those Black lives. When those planes ran into those buildings in New York, though, in 9/11, there was a panic of empathy, and we just helped. We just got it done. Nothing kept us from offering relief to those victims, right? And so I've done, I have a book coming out on August 18th in which I do a lot of research and psychological studies that point out we have an in-group empathy bias that makes us not feel the same level of care and concern for out-group members as in-group members. You know, and it happens at the level of the mirror neurons, on a neuronal level. It's not even conscious a lot of times. But the bottom line is we have relative indifference to the suffering of those who don't belong to our in-group. Now, how does that play out in terms of this police situation in which we find ourselves? Well, the solution isn't the technological ones we've learned, I think, or the policy tweaks. We have to cut back on the police department. That activists have been saying that for some time now, last several years, and now this is really bringing it home. We need to make deep slashes in the budgets of police departments and reallocate those resources to the things that the doctor before me was talking about. Address homelessness or houselessness is my preferred way of talking about it. Address healthcare, address education, address income disparities, right? We can do a lot of things if we have the resources to do them, but right now those resources are being sucked up by our law enforcement departments, right? Here in LA, we have about a $5.5 billion annual budget we're looking at coming out in the coming year. Nearly 54% of that, 53 point something percent of that in the mayor's budget was to go to LAPD, right? And you have those kind of staggering numbers around the country. Now, you know, you take that money out of those police departments, reallocate it, divert it to the kinds of problems we're talking about, and we can have a lot better health outcomes. We can address the unemployment issue, and we can have a lot less violence against Black folk generally, because the violence is often driven by the enforcement of low-level nonviolent offenses. No, you can reduce the police presence without reducing our public safety. And then you can have the police, and I'll wind up with this, you can have the police, once you divert their funding from, you know, kind of broken windows policing, you reduce their size, you have those funds go to other social services, social workers, that sort of thing, then you can focus the police's attention on what it really should be focused on, and that's solving murders, rapes, violent assaults, robberies. In a lot of cities, those are only being solved at a 40–45% rate. And that's because the police resources are being diverted from investigation and good police work like that and going toward broken windows policing. The key is to get law enforcement doing what Black, brown, Asian, white communities all want. We want murder solved, we want rape solved, we want robbery solved. We want our police to have resources to do the investigation they need to do, to track down, to hunt down, you know, repeat wrongdoers, serial wrongdoers, to break up that kind of enterprise, you know, criminal enterprises. And the only way they're going to have those resources is if they're not being diverted to go to police who are going after low-level nonviolent offenses. You know, New York, they hired 200 additional officers to go after turnstile jumpers. You know, those are funds that could have been going toward real investigative work. So cutting down the number, the size of the police department is first and foremost thing, diverting a lot of those resources to social workers, social services, the things that are going to relieve, get people out of criminogenic conditions in the first place, and then having police like a laser go after the kinds of crimes we all want them to go after.
Asian Americans have not always stood up for the African American community in this context. And that has to change. I do think that this moment with George Floyd has caused us to see things differently. The community, I think, has responded with more solidarity that I have seen than in past incidents. And this is despite the fact that there was an Asian American officer that was involved out of the four that just stood by when George Floyd was desperately pleading to take a breath. We recognize that there is racism within our own community and that we recognize that that has to be addressed. And that is part of the systemic racism that we're talking about. So part of the answer, if you will, is having those hard conversations with our own community, recognizing our own biases, and trying to come up, developing a path forward from there. Part of that is learning the history of racism in this country. Asian Americans are newer immigrants to this country. Over 90% of us are either immigrants or the children of immigrants. So again, being very candid, our understanding of this country's history, of how African Americans have really given Asian American community the civil rights that we enjoy today, is not understood by Asian Americans in the same way. Again, being honest, Asian Americans, many of us come from countries that are not democratic countries, that are very monolithic in terms of their ethnicity. And so that understanding of racism, that understanding of what it means to be American is very, very different. And so that's what I mean by having these hard conversations, understanding this history that is part of the United States. Part of it is standing with the other communities and letting them lead and taking our direction from them in this moment and making sure that we are amplifying their voices in a smart way. Sometimes leadership is by making sure that you stand in alliance and not trying to have the megaphone in your own hand. You need leadership from the very top down that really symbolizes what this country can be. Because without that leadership, without the right people in place, we have no hope at change. That we need to minimize the police force to really do what they really can do smartly. And that does not include military style weapons. That does not include tactical training with the military. To really focus in on the community, take that money and invest it in the community to address some of these social economic injustices that are embedded within our system. So if we are starting to be smart about those types of changes, then we do get to a different place. If we are smart about having those deeper conversations within our own communities and then reaching out, or really not even so much reaching out, making sure we talk to each other from different communities and getting that deeper understanding, we will make a difference.
But with respect to all three of these crises and how we move forward, we have to look at our underlying culture. The culture in law enforcement, for example, has to change through structural reform and changes in not only how we finance, but how we select those who are entrusted with law enforcement in our community. But at a deeper level in this country, we have to look at a culture that continues to accept ongoing significant disparities, discriminatory race-linked disparities in every walk of life. And we accept those unless we find someone who is able, with a study or otherwise, to directly attribute that disparity to intentional racism on behalf of someone in power. Now, it's ironic that today we are experiencing these crises under perhaps the most openly racist and exclusionary president that we've seen in quite some time. But our underlying culture still accepts those discriminatory disparities, and indeed, we perpetuate and facilitate them if we cannot attribute them directly to intentional and openly expressed racial pandemic. We have instead enacted at the federal level legislation that continues to exclude. I cite, for example, the exclusion from receiving economic stimulus checks of every person who files taxes using an ITIN or individual taxpayer identification number. Folks who file with ITINs are by and large folks who are undocumented. They are still taxpayers. And every one of those individuals and every member of their families, including their US citizen spouses and US citizen children, are completely excluded from receiving stimulus checks simply as a result of their taxes being done with someone who files using an ITIN. We know that that exclusion has a racially discriminatory impact particularly on the Latino and Asian American communities. But we accept it and have accepted it so far. I cite also the Department of Education, through Secretary Betsy DeVos, providing guidance that suggests that some immigrant students, again with a clear racially discriminatory impact, should not receive relief, according to every other student in their universities, from the federal allocations of emergency financial aid. It's these kinds of exclusions, as well as the informal demonization that results in anti-Asian American violence, the demonization of the protesters who have risen in righteous indignation about the murder of George Floyd and too many other examples of undue police violence, the demonization by the president, by his allies, and by too many others, even from the other side of the political spectrum at the local level, the demonization of these demonstrators with a clear racially discriminatory, that when our economy begins to recover and jobs are restored, we will see long-standing patterns of discrimination in employment recur. You can guess with a high degree of accuracy that the folks who will be hired back first will be white employees. That the folks who will not be hired back until much, much later in the recovery will be African American, Latino, and Asian American employees. We have to prepare for that, and we have to prevent it from, of course, the law has an important role to play in responding to what I think you've correctly characterized as an overreaction to these righteous demonstrations across the country. A lot of that is established by the tone that the president has, unfortunately, repeatedly set for the reaction. He sees it as in his political advantage to somehow demonize and divide, and he is doing that with respect to these demonstrations as much as in any other regard, and that has an impact on how folks act and respond even at the local level. I'm sitting in my office in downtown Los Angeles knowing that on the street right outside my door are National Guards people at this very point. I think that's an overreaction. I think that the curfews have in many ways been an overreaction, and I think there will have to be a reckoning ultimately about how our law enforcement and other leadership locally and nationally responded to these righteous demonstrations, particularly in contrast to how they've reacted to other demonstrations that emanate from another part of the political